Okay, folks, I think we're going to get started. Thank you so much for joining us today. Welcome to the National Center for Adoption Competent Mental Health Services, our January webinar. We're going to be talking about improving family engagement and child welfare services, and we have an excellent panel for you today that we'll get to here in just a second. I just wanted to cover, as with most webinars, some housekeeping right at the top. We are recording today's webinar. And the recording will be sent out probably in a week or so post-webinar to all registrants. Please put any questions in the Q&A box, as well as we encourage you to interact with each other and with us through the chat box. And we hopefully will have time for some Q&A at the end. You all are muted. If you do want to be unmuted or speak up, you could either put it in the chat or you can request to be unmuted, and I will hopefully figure out how to do that. And I think we are going to start with a poll, if it works as intended. So for this poll, you're just going to use your phone. If you're not familiar with Slido, you just can scan the QR code, or you can go to slido.com, and that's the code that you would enter. Okay, what strategy have you used to engage families or be engaged as a parent? Active listening, I see that a lot. Setting clear expectations, family meetings, parent network. Using connections, that's well-timed with what we'll talk about today. Joint home visits, meet them where they're at. You guys have some great ideas and strategies. Addressing barriers. Using humor, building rapport, that connection piece. Finding commonality, yeah. These are great. Thank you for sharing. Okay, I am now going to hand it over to Arnie, who is going to introduce our panel.
Good afternoon and welcome to our panel. It's an honor to be here today and to talk about engaging families, parents, and the child welfare and mental health community. Like I said, my name's Arnie. I'm the executive director of the National Foster Parent Association and a member of the community engagement team here at the National Center. And I come to this space today with lived experience of foster care and adoption. My wife and I were foster parents 22 of the last 25 years. We did a lot of work with sibling groups. We had the privilege of having over 150 different kids live with us over that 22 years, and we adopted 4 children from the child welfare system. We have a great panel today, and they're going to talk about themselves a little bit and some strategies that they've learned or seen utilized in obtaining adoption competent mental health services, or whatever they need in the child welfare system. But I wanted to start with one quick story. A few years back, I had the opportunity to have dinner at an award ceremony with Dean Rick Barth from the Maryland School of Social Work. And he's an adopted father of 2. And in discussing with him that evening, I asked him a quick question. I said, Dr. Barth, if you had one thing that you could do over or change in your adoption journey, what would it be? And he looked at me and he responded very quickly. He said, I would ask for help sooner. And that's one of the things that I think about. And one of the things that I think as parents, we don't do enough. We internalize it. We hope that tomorrow is going to be better. We don't sit down and share with friends or colleagues or people who care. And as a result, we don't ask for help. So ask for help sooner. That's what my mantra has been. That's what I live with every day now as I work with my kids, as I work with our adopted children who are adults as well, that there's no shame in asking for help. So I hope you enjoy our panel today. We're going to start with Karen. She's going to introduce herself, then we'll move on to Mary, and then we'll finish up with Edward. And in their introductions, as they finish up their introductions, they are going to also give a strategy that they have learned or seen or utilized in obtaining the help that they need, a solution, so to speak, for connectivity. So, Karen, you're next.
Hey, well, thank you so much, Arnie, and what a pleasure to be here today. Um, I reside in the state of Oklahoma currently, and I know I've seen on the chat there are some folks that are checking in from my state. But my husband and I became foster parents when we were residing in the state of Illinois. And through that process, we had two little biological sisters that joined our family. The oldest one was 16 months, and her younger sister was 4 weeks old when they joined our family. And both of them are on the fetal alcohol spectrum. In 2002, we finalized our adoption. In fact, we finalized it on Christmas Eve. And so my girls are now young adults. And one of the things that I have learned over the years, because our daughters have been seen by mental health professionals throughout the tenure, particularly child psychiatrists over the years. And one of the things that I have really learned and so appreciated is when mental health professionals really inquired of my husband and I, and there's one in particular, I'll never forget it. It was a board certified child psychiatrist here in Oklahoma. And he said to my husband and I, "What do you do to take care of yourselves as parents?" And I thought, what a critical question. I mean, I've never forgotten that to that day, because I think he's one of the very few who's ever inquired about what we do as caregivers to care for ourselves, because he understood very well that if we weren't caring for ourselves and our needs, we weren't we wouldn't rise to the level of being fully capable of meeting the needs of our daughters. And so that's something that I've learned. And so sometimes, even since then, if someone doesn't ask me the question about how do you take care of yourself, sometimes we'll just volunteer it. And here's what we do, as a couple to take care of ourselves. But that's a strategy that I learned from that very wise child psychiatrist, is to really inquire not only about how the patient, how the client is doing, but how are the caregivers? How are the caregivers of the child doing? So that's kind of my strategy that I've done over the years for connectivity. So Arnie, I'm going to kick it back to you to go to the next panelist.
Thank you, Karen. Mary, you're next.
Great. Thank you so much. So my name is Mary Viano. I go by she, her pronouns. I'm actually from the state of Massachusetts. So excited, as Karen had said, just seeing all of the people that are here nationally is impressive. So thank you for all of what you do. I come to you as probably my favorite thing is to be the mom to three young adults, all that I adopted. I did adopt a sibling group as well. And then my daughter had some sassy needs that came with her on top of being a girl. She also had medical needs, and she was considered a specialty adoption because she had Down syndrome on top of that. The sibling group is two boys, and they came to my family. All of my kids actually came to my family over the age of 4. So they were a little bit older than the typical receiving kind of an infant at care. Like Arnie had mentioned, I've actually done foster care for large group of young people that came to my home after adoption. So I was a foster parent for many years, and I often was a foster parent that would get a child that would come sometimes 3 to 6 months because their parents were thinking about terminating the adoption. So there was a unique place, both either international adoptions or local child welfare adoptions that came to my home. I often said when I had another kid come in, my kids that were adopted actually got right on board, that they were there to kind of help teach this other kid different things, but then they struggled themselves. I would say foster parent, adopted parent, and then also I decided to bring home a grandchild that was born that my son struggled with and his mom. So I did kinship as well, and excited to say that after 4 years of being in child welfare, was finally adopted before he was 5 years old, which feels very long for a grandparent to get rights for a child. So kinship is very close to my heart as well. The one piece that I think really comes up for me, and kind of a strategy that Arnie had mentioned, and I think many of us will like what the others are saying, because Karen, I'm right there with you on kind of taking care of ourselves. Two of the strategies for me, one is it's really hard to meet other parents like you, and it's important to allow the parents post adoption to meet other families like them with the unique needs. That was a real big connection for myself, that really helped. And then I think that, one of the biggest pieces for me, and Arnie touched on this too, where kind of asking for help was important. The other strategy that really comes up for me a lot is giving myself grace, that the most nurturing and loving environment can't solve all things that are in front of you when trauma is involved. And I wish I knew that sooner, because oftentimes as adopted parents, we're in it to make it, and we're going to make it like, I think kind of my own pieces, and I'll speak for myself, is I thought I could fix and love it all away, where often in mental health and trauma, you can't. So I think that that's another strategy, that I think the nurturing component can't often do it all with kids with complexity of needs, and also families. So those are my two areas, and appreciative to be here. So I'll hand it back over.
Thank you very much, Mary. And now, Edward, we're going to hear from you.
All right. Thank you so much. I appreciate it, Arnie, Karen, and Mary. I really like your strategies. First and foremost, I'm a proud father of 3 children. My oldest is 28, my youngest is 18, soon to be 19, as a matter of fact. Can't believe it. But I'm also a grandfather of a 3.5-year-old granddaughter and a 2.5-year-old grandson. I love being a father, love being a grandfather. I've been working with fathers and families for about 15 years now. Most of those fathers were involved with child welfare. And I'm thinking about a strategy that I think there's several when working with fathers, but what really comes to mind that I've seen work is authenticity. And what I mean by that is fathers know if they're really being engaged, to see their perspectives on their families, or if they're just checking off a box. And I've seen it work where workers take the time to get to know the father, get to know the family, value them as experts in the family. And a saying that I think of a lot is relationships are built at the speed of trust. And I wish I could claim that, but I heard it from somebody else. But it's so true. It really takes time to build those relationships. And what I've seen with that authenticity with the fathers is once that relationship is established, there's respect, there is trust, they open up. And so you're going to hear really what's going on with the father, what's going on with the family, what the dynamics are, and what support they really need. And that's what I've seen as a strategy that really works, because it really comes down to you want to make a connection. We want the best for the children. We want the best for the family. And it doesn't really do any good if we're just putting up a face. We need to be authentic. So that's what I think of when a strategy comes to mind.
Okay, well, thank you all very much. The things that I heard in this first set of questions had to do with taking care of yourself, remembering that you can't love every problem or situation away for your kids. And Edward, you had the great statement that said relationships are built at the speed of trust. So those are 3 interesting strategies and skills as we think about our first question. So Now we'll move into our second question. And the second question has to deal with what skills do you think or have you seen social workers or community members use or have to help families engage in the system, in child welfare, mental health, or in the services that are available that their family may need? So what skills? And we're going to stay in the same order. So we're going to go with Karen, then Mary, then Edward.
Well, skills that I've seen and skills that I think are very important for engagement. First of all, listening. I think a lot of times we get so busy and caught up in what we're doing is that sometimes we don't really listen with that intent to be able to really hear and maybe even hear and really observe someone in their total communication to us. Because I think we are all aware of the fact that um, what people say is just a part of their communication. There's a whole body language, that goes along with that. So I think being very, listening and observing and being very observant about what's being said and what's occurring. I think that's huge to getting people engaged. And I also think not being judgmental. I know I worked for many years in child welfare. In fact, I worked in the state of Illinois as well in the state of Oklahoma and have the privilege to serve as the post-adoption programs manager for the state of Oklahoma for a period of time. And whenever I would talk to families, there were families who sometimes were scared to share things because they thought they were going to be judged. They thought they were going to be judged as being inadequate to meet the needs of the child in their care. So those are two strategies that I think are very important, is that listening and observing with intent, and also not being judgmental, because I think sometimes people are just terrified that someone's going to judge them as being inadequate.
And I think that the piece, Arnie, that you want me to jump right in, Arnie?
Yes, please. Go
Okay.
ahead.
The piece that I would also mention, the two things that come up for me is really sitting in a level of curiosity. So listening to what families are saying. I think that families talk with emotions sometimes, and it's not really clear what the need is, right? There's a lot of emotions that connected to it. I often said, like, the chapters I have with my family, like, there's a lot of information to get out. And I think that one of the things that it really takes for families, and I know that my skill hopefully has improved, right, is narrowing down exactly what I want. But often we tell in stories. So really being curious of what you hear, asking curious questions can be another piece that really helps that communication component, and really listening to kind of where that family is at with like a no blame, no judgment, to try to really understand what is there. The other thing with the curiosity that brings up for me before I send it to you, Edward, is this level too of meeting families where they're at. I really believed that a lot of what I dealt with was just transitional. And I'm like, this is one long transition. We're now hitting 2.5 years, right? Like, I wasn't prepared for the level of components. And I'm not pointing blame to anyone. It just is the reality of like absorbing that within your own circle and what that looks like, and showing up with a level of understanding of what comes up. There was often a joke for my kids that like every emergency tend to happen on a holiday. I didn't realize like Groundhog Day and some of the other days were the holidays too, but it just there was emergencies at every holiday, and I was like, this has to be transitional, right? Like I tried to find out that reason, but I think just really sitting in a place of curiosity with no judgment. And also, I think for the family members, the strategy for us is often we've got this unique sense of humor when you live this world. You're like, you can't make it up sometime. And I often wonder to the workforce, like what that feels like with that I know in parents groups that we can understand it. And I think workers that have been in it, you have it just as much as us. But I think that strategy of understanding sometimes humor is your way of getting through it. It's not often directly about the child. So hand it over to you.
Thank you. I really like that, listening with intent, and really meeting them, the parents, where they're at, right? Meeting us where we're at. We're parents, right? And I think that's a whole nother thing to look at, is putting ourselves in somebody else's shoes. Um, what I think of really is strength-based approach. A strength-based approach when we're working with families. I think a lot of times it's easy to come in and say, okay, well, this is wrong, this is wrong, this is wrong. And as a parent, you're thinking, okay, am I doing anything right? So going in with a strength-based approach and child-centered is huge. And I've seen that really work well with case managers and families, to say, I'm not sugarcoating anything, but at the same time, I'm meeting you where you're at. This is what needs to be done, and how can I support you in that? And here are the strengths that I see in your family to help reach these goals. Um, Another thing is too, the transparency. Another friend of mine said radical transparency, and I was like, whoa, where do we hear that? I mean, we hardly hear that, right? And I think it's at time appropriate, right? If you got to say things for appropriate for the time, but be transparent of what the goals are, what we can do together as a team to build that team together as a family. So that those are the things that I think of.
Well, thank you all. I just wanted to say there were some great tidbits here in this question, listening to hear, not being judgmental, strength-based, meeting people where they are. But last week, when we did our briefing for this panel, uh, Mary talked about sitting in a level of curiosity. And I've thought a lot about that, particularly since curiosity is one of my word goals for 2025. And I just was thinking about just having curiosity. Now I have added something else to that, sitting in this level of curiosity. And I haven't been able to tear all that apart yet, but um, I'm trying to think about the levels of curiosity. Do I just have a curiosity to just kind of know something, or do I have an radical curiosity? Like Edward used the word radical transparency. Am I going to continue to look for solution with this kind of radical curiosity to find the answer? So, uh, as we move to the next question, this one's tailored a little more toward Edward because it talks about meaningfully engaging fathers. But each of our panelists have also had engagement with fathers. Mary talked about her son as a father and then how that impacted her in a kinship relation. So, as we think about this and as we think about strategies or solutions to dealing with fathers, we're going to go in reverse order. Edward, Mary, you're stuck in the middle, and then Karen. But let's talk about what does it mean from your perspective to meaningfully engage fathers as it comes to this child welfare, mental health interaction. So Edward, Mary, and then Karen.
All right, thank you. So I can share several different stories. One, and I'll share of my own with my involvement with child welfare. And I remember a case manager, I think it was in the very beginning, I said, I'm going to do everything I can, make sure my kids are okay, get them back, do what I need to do. And I remember her saying, well, I know you think you're Superman, but let's just see what happens, right? So for me as a father, I was like, okay, okay, I'm gonna show you, And so I worked really hard to do what I needed to do for my kids, for my family. And I worked with another case manager who recognized the strengths in me, recognized the work that I was doing, recognized the relationship that I had with my children, and built on that. So there was stark difference between the two. One, it was kind of dismissive, right? Like, okay, yeah, we'll see, you know. The other one was like, yes, I do see that in you. So I think of that for my own story, but I also think of the many fathers that I've worked with that just felt like they weren't being authentically engaged, that they just weren't being addressed as someone who is important to the children, somebody who's important to the family. And I think when fathers, especially myself as well, when we're engaged in that sense of they do see our strengths, they do see our love for our children, and to build on that, we change and we open up and we share what's really going on. So in my instance, my son was doing some counseling, and the counselor got moved to a different place or whatever, and I was able to advocate for my son who needed some mental health support. And probably wouldn't have been able to do that had I had not had a case manager who really believed in me and believed in my strengths and was able to support me in that. And I think that's the case working with most fathers that I have seen. They need to know they're respected. They need to know that they're important and that others see that in them as well. That's what I get think of. I'll turn it over to Mary.
You know, I'm so happy that you said that, Edward, because one of the things, and as you mentioned, Arnie, I really had to figure out like how to help my son as a young parent. Um, he was an afterthought. I'm just being honest, like an afterthought of getting an action plan, right? There wasn't a piece even prior to like losing custody. I think I know within my own state, child welfare is actually the leader in including fathers, but other state agencies aren't. And I think there's still more work to be done, but it's been very purposeful. I do think that one of the things, the strategy for me really in the engaging of fathers is we have to figure out how we're interacting with fathers, right? How we're actually interacting. I actually look at this as engagement as a staircase. How are you interacting? How are you involving? And then how do you get to engagement? We talk a lot about like that buzzword of engagement. You can't get to engagement if you can't sit in a room with Edward and say, "Hi, Edward. How are you doing? What are you bringing to the table?" Right? What are the positives? If we want to get to engagement, we've got to interact with fathers in a meaningful, purposeful, authentic manner. It can't be an afterthought. The other thing that I think that is really important is that is something to reflect is as systems, I think system folks, what I noticed is um, when there wasn't a father present, and I walked in actually as a grandparent, but I want to really keep this in the fatherhood conversation, but I could switch the hat to grandparents. I would often say like, well, where's the father? Before of where was the mother? They assumed I was my daughter was the mother and I had the kid, but actually it was my son's child, right? There's a lot of assumptions. If we want to do true, authentic fatherhood work, we've got to deal with our biases. And I'll throw my biases. I was raised by a great grandparent. And it was a grandfather. That was my father figure, not maybe my bio father. But the biases right away was, oh, the bio father wasn't involved. There must be challenges. I had an amazing great grandfather that raised me as a father figure. But I think it's really eye-opening for us to think about where our biases and experiences are. And then the twofold pieces, you've got to be able to sit comfortably with the culture of fathers and interact in an authentic way before you think you're engaging well. And I've got work to do too. I know as a grandparent raising a grandkid, I'm having those real conversations with my grandchild. But how do you have it in a positive light rather than saying Edward needs to put on his cape and become Superman, right? Doesn't he have a purpose to connect right away? So those are my thoughts. Karen, I'll hand it to you.
Well, thank you. And and I agree with everything Mary and Edward have said. I think, in engaging and encouraging fathers is so important because I think, and I even think in my own situation, my husband was wonderful, with our children and engaged our children in activities and in things that particularly outdoor kind of activities or sport activities that I didn't engage him in. But we also had involvement of an uncle. I have a brother who's very involved in the situation. A grandfather very involved. Friends of the family that were men that were very involved. So, I just agree with everything you've said, that, the importance of fathers and those father figures, whether it be an uncle or a grandparent, are just crucial, I think, in the lives of children, and for us to be able to engage them and encourage them to take those strengths and assets that they bring to the table and really implement them fully.
I, I think that's great. I just want to say something real quick, Arnie. I would love to hear your perspective, Arnie, on how to engage fathers as a
Mhm.
father yourself. What about you? You might be muted. Oh, uh-oh.
He'll
Jump off.
rejoin us.
Jump off and come back in.
Seems
Well,
like he was having
I'll say
some audio.
something. I'll say something real quick, and I think Mary and Karen, I agree with everything that you said. And one of the things that you said, Mary, was about the bias, and that is called fatherhood bias. And it's maybe not intentional; it's just kind of ingrained, and that's something that is everywhere, and that's changing the mindset and the culture when working with fathers, because it's really about the children. And when fathers are involved, children do better. So that's my personal mission, and professional mission as well, is to change that mindset and culture. But Arnie, back?
Is that back?
Yes, perfect.
Okay, well, we prepped for this because I had this problem the other day. And so, anyway, thank you all for allowing me to come back. I think that what I would say is I had the privilege over many years of being a foster and adoptive father to be self-employed. So I've been always able to have a very flexible work schedule. But it's meant that I, as the father, took the kids to lots of doctor appointments, lots of psychiatric appointments, lots of dentist appointments. And the other day, I had the privilege of taking our 22-year-old son who has Down syndrome to the dentist. After years, I finally found a dentist who appreciates the fact that when Dylan gets his teeth cleaned, his father sits beside him at the dent on another chair and holds his hand. That's what works for him. We've gone through sedation. We went through dentists saying we can't take care of him, to finally convincing a dentist just to let me sit there and hold his hand. I've learned from that. I'm significantly impacted and changed from that. And just last week, I had the privilege to sit there and just focus on that hand while I held it, realizing that I had an incredible opportunity as a dad to be there for him, but I had also had the chance to advocate and say, he doesn't need sedation. He doesn't need all this. He just needs somebody who he trusts. We had that. Somebody earlier, one of you all talked about trust. We've talked about radical engagement. Being there for him is one of the things that I've had an incredible privilege to do. But it's not that far outside of the box, but somebody has to be there for him. And it's so much easier now that they just listen. So I think those are the things as a dad that have just been an incredible blessing to me. I get to go with my kids to many counseling appointments. And now they know that I'm a softie, and more than likely they're getting ice cream or McDonald's fries or crumble cookies or something on the way home that mom won't give them. So they're asking for dad to take them, but it's given me an incredible opportunity to be their dad. and to advocate for them and learn to do it. So hopefully that answered your question.
Thank you, Arnie. Yeah, I love hearing your stories, so I appreciate that. Thank you.
So we're getting to the end of our talking, our discussion. We have one more that talks about if we could implement one strategy, what would it be to make a difference? Just one thing that, hold on, my wife's pounding on the door. But let's go ahead, and Karen first, then Edward, then Mary. We'll switch it up. One final thing you would like to see done in child to make a difference or a solution, and then we'll have some Q&A.
I think for me, it would be working with individuals who understand the nuances and the difference that fostering or adopting has made in someone's life versus your biological child. And understanding how that trauma impacts the children, and also understanding that in terms of adoption, that there are normal milestones in adoption that are normal as children age. And I just think people understanding and being prepared, and I think that's why we talk about adoption competence and having mental health professionals that are adoption competent and understanding the nuances and the difference that brings forward in caring for our children. So that's mine. And are we going to Mary next?
I think Edward's next.
Oh, okay. I'm sorry. Go ahead, Edward.
Okay, all right. Wow, let's try to narrow it down here. One strategy and solution. I would say strength-based lens when working with families. I think that what I have seen in my experience is when that is applied, families do better. Families are more open to receiving services that are being recommended when you build on the strengths in the family. So strength-based lens, that's mine. Mary.
So I think the strategy that I would say is that every family has an opportunity to have hope and empower them. I think the empowerment and hope is really key to allow, and I agree. I mean, I would Karen and Edward kind of hit those solutions right where I would go to. So it's almost like we want all of them together with those strategies, because if you can hold hope and also empower people, I'm a true believer, and I was often asked. I shared this with our group here when we had met. I know one of the solutions that was on the table when my kid had significant attempts to die by suicide at age 9, one of the quick fixes that was told to me is that you could return him to child welfare. And that wasn't hopeful, and that wasn't empowering, right? Like I wanted to figure that out. And I think sometimes that things get so desperate that we figure out we say things. I know I make mistakes and I have to own them. So I think it's really about that hope and empowerment and to work through it. We're dealing with sometimes some of the most unique individuals that really need both interventions and love and support. But I like what Lisa had put in the chat box of you can't, love health away, right? The health, you can't control that, right? That there's not enough love to just fix that. And I think that really brought that up for me, is that sometimes you need those interventions and support. But if you have hope and you have empowerment, you could possibly get through that. So really appreciate that as a strategy with you all.
And as I wrap this up and then go to Q&A, I would say that thing that I think is a solution is to emphasize community. I think that one of the things I have personally benefited from the many years that I've been engaged with foster care and with adoption is I've had the opportunity to interface with incredible families who've experienced struggles, and we've been able to gain strength, gain perspective, but also gain a shared hope that we can together can find solutions. So continually working to build community. And I shared last week when we did our briefing for our prep for this is the fact that Karen and I have known each other for quite a while. Michelle and Edward and I get to work together on the community engagement team. Mary is somebody I just met last week, but I know that she's somebody I'm going to be reaching out to, somebody who has already been part of my shared community. So I don't think we can emphasize enough the importance of shared community. Making sure you know who you can text at 11 o'clock on Saturday night when you are just at the end of your rope. Somebody who's not always going to have the solution, but somebody who's going to say, I will sit with you here in this moment of unknownness. So continue to encourage shared community. So that brings us to the incredible Q&A, or Michelle, it looks like you want to say something.
Yeah, got a Q&A for you. So we were going in the same direction. So the question that came in is, how have you needed repair or would recommend repair with a professional who has made a mistake in engagement with you as a parent or a caregiver? Which is such a great question, right? Because everybody makes mistakes. And I love the idea of putting it out there in a place of vulnerability. How do we make those shift? How do we shift back? How do I get some type of repair there? Mary, I saw you come off. Help us out.
Yeah, I think the two things, I saw Edward too, so I'll make mine quick, but I think one of the things is you have to own that you made a mistake. You've got to own it. I mean, if you're a clinician and you've never had children, I ask you if you're a parent and you say yes, parents find out the truth. Just tell the truth. That's one piece that I would say is to tell the truth right away. Also, like owning it and also asking the family that you want to repair. One of the biggest pieces I think that we miss is sometimes we talk about families and the young people needing to repair it. As partners in the community, we have to repair our relationships together as well, right? So, what do you need to see that happen? How does it look? I often say, you know, in our stage, we talk about, I was a family that unfortunately, because of the wildness within my home with the kids I adopted, there were often filings of abuse and neglect because of what they heard. And we believe in best practice. Listen, if you have to file on a family, you tell the family and you file with them, right? It's not an easy thing to do, but sometimes we have to do what's necessary. I would say first, we want you to be mandated supporters before you're the mandated reporter, right? Let's work together, but we've got to own it together. And I think when you model that with parents and families, you're going to see that come back to you. And then the last thing I will say is I think that the caseloads that workers have is huge. And sometimes we make mistakes or we didn't get something to a family. And I think owning that, right? I've got some timelines I've got to own it to with people right away, right? I made my list earlier this morning, but we've got to be able to own that. And I think you earn credibility that way. Edward, I think you wanted to jump in.
Yeah, I was pretty much going to say the same thing. We have to own it as professionals, right? Look, I made a mistake. I got to put my ego aside. I got to put my pride aside and say, you know what? I really made this mistake. Be honest about it and say, but I would love to, rebuild the relationship. I want to still support the family, but I made a mistake. And a lot of the times it's hard to do. It's real easy to say until you're in that position, right? Because it's like, well, I don't make mistakes. Well, yeah, we all make mistakes. And so I think just setting the ego aside and saying, I made a mistake, but I would like to work on it. So what can we do moving forward? I think that goes a long, long way. Just simple, short and simple.
I really love that and the whole thought process behind acknowledging, right, apologizing, being accountable. I really want to take it to the next level and being like, not only do I need to apologize to my participant or parent, but I need to rectify things. There needs to be some restorative justice in it. Was my error in the court report? Was my error in a case plan? Did you hear something that I interpreted wrong that maybe you had consequences for? What was it that I did that misstepped? And where else do I need to go in order to make sure that I fix that? And then share that grace, right? And I feel like that models something, right? If I can say, I made a mistake, I'm sorry, and I'm gonna go fix it with all of these other people, then when my participants make a mistake, they can be like, hey, I made this mistake, and my response isn't going to be punitive. Karen, what do you want to add to that?
Well, I loved your comment about extending the grace. And that was something that I was thinking of as a family member, so that when someone comes forward and says, hey, and they own it and they say, hey, I messed up and I'm so sorry and let me make it right, then I need to have the grace to step forward and say, you know, things happen. None of us are perfect. And thank them for acknowledging the mistake and for whatever they're going to do to make amends. And hopefully that makes the relationship going forward even stronger when you can extend that kind of grace.
Absolutely. Mary kind of started out talking about making a report and kind of what that looks like. And I know in my professional career, I've had to make a few reports. I was a case manager, like that was my role. So we had a relationship. And in the beginning of my career, that was really hard. And it was almost like something that was done in the closet, right? I went and consulted with my supervisor. I made this phone call. I set this up, and everything was hush hush. Everybody knew I made the report, but the participant, they didn't really know, they could guess. And that usually caused a rift between my relationship with the family. But in times where I sat down and said, now, we've spoke before, and if this happened, I might have to make a report, and I'm going to have to make a report. I don't know if it's going to be screened in or not, because that's not my job. How do you want me to handle this? Like, let me know when they call you. Like, how's that going to go down? In most of those cases, if it was screened in, they were like, hey, Michelle, the investigator's coming over on this day. Can you be there as well? And I bet I made the report. And that was okay with them because they knew, right? It was that honesty, and it was moving into situations where we can say, I'm not sure, right? But we all have a job to do. Absolutely. Do we have any more questions coming in? I think one of the things that I would ask right now is, I'm wondering, Edward, when we talk about father engagement, what are some like practical strategies that you can think of to help engage fathers um, beyond what we would say is that normal send a letter, call the last number, ask a kid? What are some other things you can think workers can do?
You know, I think of engagement, and I think of three different things. Invitation, that's where you're inviting the father to participate in something, right? And then engaging the father when he's there, talking directly to him. But there's a whole nother level that I think that we need to go to, and that's partnering with the father. Because once the father feels comfortable, feels like there's a team effort here, there's a partnership, there's like a goal for that. And I think yes, there's the invitation, trying to find the phone number and reaching out directly to the father and build a relationship with that father. Ask the questions strength-based wise. What's going on with them? How's work going? Whatever those questions are, so you can build that relationship. So then you're able to open up the service array or find out what's really going on with the father. So I really, what I have seen work, and it takes time. Like I said, it really takes time to build the relationship with the father, but to, talk to him specifically, directly, not through mom or through his mom or through somebody else, but directly to the father. How are you doing today? How was work? How's it going with your kids? Whatever that is, to build that relationship, taking the time to do that.
That's interesting. You just kind of, I'm that guilty one that calls grandma. And
Oh
like,
yeah,
and I
yeah,
often use dad's
yeah,
mom in order
yeah.
to, and like, I'm going to talk to dad as he does, but I'll be like, call grandma, because grandma will get dad on the
Yeah.
phone with you. And, but I like the idea of, I might use that as an initial
Yes.
contact strategy, but I need to respect dad enough to move grandma out of that communication once I have established a relationship. And I think sometimes we forget to do that.
I think so, and that is a strategy too, because I know my mom calls me, I'm going to do what she says. So I
Yep.
love my mom to this day. She can tell me what to do, and I'm going to do it. So I think that's a good strategy. But then growing in the relationship with the father himself and moving beyond that. So you're absolutely right. Yeah.
The other thing, Michelle, that I was going to add in that to kind of complement too, Edward, what you're both saying is it's okay to empower the father to say, do you want to bring a supporter? Who do you want to bring? Right. So you're switching that dynamic where I would say to my son, like, listen, I'll show up anywhere, but I want you to invite me. Right. I want you to take ownership. Let's switch the seats. Right. The biggest piece, I think, in family driven is that the family drives it. Right. And then you want your young person to get in the driver's seat because you want to be youth driven. Well, when do the fathers get to drive it? Right. We let the mothers know often to be like, who do you want to bring to your team to support? But are we truly asking fathers to empower them to also bring who they want? And then not judging who they bring. If they bring three fathers, we'll be ready for three fathers. If that's who their support team is, right? To be prepared in that.
Absolutely. And
That's
I,
really
I want to
interesting. Go
go ahead.
ahead.
Okay.
No.
Sorry. I think another important thing when working with fathers too is the peer support from other fathers. You get encouraged from other fathers and other fathers being vulnerable and sharing what's really going on with them. I've seen it in many of the groups that I've held and supported. Once these fathers open up, there's a vulnerability that they've got to show one another to really see what's on the inside and then get the support from each other to address it. And it's really powerful. So peer support from other fathers.
Yeah, I love that. I was kind of thinking about, as workers, we ask questions about what the involvement has been in the past. And then sometimes we will use that information in order to justify not doing any additional engagement or follow-up, and really thinking about how important it is to ask those questions. Well, if you haven't been involved, why haven't you been involved? And how can I help you become involved? And putting value in that relationship and making sure that fathers are supported in being able to establish or reestablish relationships. I think I'll hand it over to Ernie, and maybe we'll give everybody's last words if we don't have any more questions. And there you go.
Well, hopefully my sound is working. And I just wanted to say this has been a great hour. It has gone incredibly fast. It's an incredible group of panelists. I appreciate each of you, and I think that the thought that I leave with is the fact that we have an incredible opportunity to choose our community and to enhance it. And I'm thrilled that each of you, as panelists, as engagement team members, that you are part of my community. And I would say, please, please, please encourage each person you work with to go beyond their vulnerabilities and intentionally enhance their community. So Karen, a last word, then Mary, then Edward, and then back to you, Aaron. Thank you.
Well, I'm going to draw off something that Mary said earlier that I absolutely love. And it goes to this about community, and that's being a mandated supporter. We need people around us and around our families that are supporters. I mean, to undergird and to connect with us. And I love that term. I'm going to remember that, Mary. I am so glad you shared that. Thank you so much. I think that community of support is absolutely crucial. So I'm handing it off. Is it to you, Edward?
Oh, I think I'm the middle child.
Oh, okay. You're the middle one. Okay.
No, thank you. I do want to recognize Children's Trust is doing a lot of work on that mandated supporter, so it's not mine specifically, but I really think I appreciate Karen the shout out. So following some of their pieces, I think for me, it really is about when I think of the community, it's about partnering with each other and recognizing our own biases. I think the more that we can do, like, let's work together to do less harm and more help. And I think sometimes when you don't know the full story, it's easy to jump to something else. So, kind of stopping in the pause would be my biggest piece. Stop in the pause and think about what can you do in the best aspect for that family, for that young person, for that father, for that grandparent, and take the time and the pause to do it with authentic, hopeful, and empowerment. And going to Edward's word, strength based. We need more strength behind us than we need challenges. And again, it's a big thing to uphold because all of you are doing very hard work. So I appreciate the time. Edward, the middle child, will hand it to you.
Thank you. You both said so much great things, so many great things. So I think for 2025 and beyond, the word is authentic. We need to be authentic with ourselves, with each other, use a strength-based lens, put ourselves in other people's shoes. I think there's a lot of the times a lot of judgment and a lot of biases, and really work on our own biases when they come up. Don't brush them aside, but let's really work on them and just show a lot of love. That's what really comes to mind right now. My grandkids are banging on the door wanting to come in, and I just think show lots of love, be authentic, and look at families as if they were your own.
Wow. Thank you all once again for being with us today and sharing your valuable wisdom. I think this was an excellent webinar, and I know that I learned a lot. And with that, will close. Please do, you'll see the survey pop up as you're closing out a Zoom. We would love to have your feedback. We're offering these webinars at least once a month, and your feedback will help inform future webinars. Thank you all for being with us today, and please come back again for future webinars that we host. And have a great rest of the day.